Help is on the way! You are not alone. Melasma is super frustrating to cope with because it seems like no matter what you do, no matter what you try, sometimes it gets a little bit better, but it often recurs. It consists of these brown, tan to grayish patches of hyperpigmentation, bilaterally symmetrical, meaning on both sides of the face, usually on the cheeks, the forehead. If you're struggling with this condition, I highly suggest seeing a board-certified dermatologist because it usually needs multiple different treatment approaches to get the best outcome. For example, prescription hydroquinone or Kligman's formula, oral tranexamic acid, light chemical peels. But don't despair, there are certain things that you can and should be doing proactively to help it fade and to prevent it from recurring. A non-negotiable here is going to be aggressive sun protection, wearing a broad spectrum sunscreen every day, even on days you're mostly indoors. It is a photosensitive skin condition. Sunscreen is a must, as well as other sun protective behaviors like sun protective clothing, seeking shade, and avoiding being outdoors during peak exposure times. Now, I don't really care what sunscreen you use. It doesn't matter if it's mineral, chemical, or hybrid. The best sunscreen for your melasma is the one that you're actually going to use. I would draw your attention to tinted sunscreens. Tinted sunscreens have ingredients called iron oxides, and they don't protect against ultraviolet radiation, a major contributor of melasma, but rather they may offer some protection against visible light in the blue light wavelengths. If you have richly melanated skin, this is especially important because these wavelengths of visible light are known to aggravate hyperpigmentation. But here's something that might just blow your mind. Heat is also a big aggravating factor, so I suggest avoiding hot saunas, hot yoga even. And you definitely want to avoid those facial steaming devices. And speaking of skincare routines, you want to keep it really simple because using too many products or products that are irritating to you can actually aggravate melasma. Another aggravating factor that you really can't control necessarily, but you should be aware of is hormones. It's not uncommon for melasma to appear during pregnancy, also with oral contraceptive pills.